The hip flexor nerve glide. So the hip flexor nerve glide, we want to set up in a nice strong base. The first cue is our stabilising leg out the front is at a nice strong right angle. So strong stable foot, and then we're straight out from our midline. So don't let that leg drift out to the side, it's straight out in front. The second cue is to have the leg that you're stretching with that knee directly underneath hip and then your toes curled under. That's our starting position here. Don't move into the stretch just yet, stay through this position. The first cue is belly button into your spine. So breathe in, fill up your tummy, breathe out, belly button into for an abdominal vacuum and hold that there. Second cue is a pelvic thrust. So we're looking at a posterior tilt to the hips. So dropping that back and you'll feel that belly button in, posterior tilt. You'll feel that hip flexor kicking straight away. The third important part of this drill is to squeeze this bottom. So you use some sensory input to rub and stimulate that bottom. So you can pinch, you can slap, and you can rub that bottom and squeeze your glute as hard as you can. Keeping belly button in, posterior tilt to the hips, glutes switched on. You can have your hand on that bottom, and I stress that you put it there to maintain that glute contraction. From here, we're then gliding forward, keeping the tension on in your bottom, belly button in, posterior tilt to hips, gliding forward for 10 to 12 glides, pushing through, nice and tight, keeping belly button in. Once you've done 10, come up out of that position and then repeat on the other side. So we're going to set up nice and strong again. Knee directly out front of hip, lower leg directly underneath that knee, foot flat on the ground. Back foot is curled under in a track start. Left knee directly underneath left hip. 3 cues now. Belly button in. Posterior tilt to hips, so pelvic thrust. Squeeze this bottom and then use your hand to pinch, slap or stimulate that tissue, the nerve endings in your glute to really increase the sensory receptors in our brain to say this is where we're firing, trying to switch off this front nerve through here. When that's on, belly button in, hip tilted, we then glide forward. So if you're going all the way down through here, you're not keeping that posterior tilt or the tension in your abdomen. Belly button in, tilt that hip, squeeze your bottom, gliding forward just 1 or 2 inches for 10 to 12 repetitions, all the way through. Maintaining hand on your bottom so you can really feel it when it switches off. When it switches off, rub it again, pinch it, make sure that you're trying to contract it as best you can for the hip flexor nerve glide.